Well, good afternoon, everyone. This is opening day for baseball. We wish the Reds and the Indians all the best. A little cold opening day. Reds, of course, open at home in Cincinnati. Indians will be in Detroit. So we wish them both well. And opening day is a time for great hope. Hope springs eternal on opening day, and I think it's appropriate this year as we have the vaccine now, and we're moving forward, and we have a great deal of hope about what this spring and what this summer is going to bring for all of us in Ohio. Fran and I are joining you today from the Dayton Convention Center, site of one of more than a dozen state-sponsored regional mass vaccination sites. The public health of Dayton and Montgomery County has done a phenomenal job. Fran and I had the opportunity to walk through and see everything that's been going on today and really talk to a number of people. They've held dozens of large-scale clinics here at the convention center, but this is the first clinic operated here as part of the state's new regional mass vaccination program. Health Commissioner Jeff Cooper took us on a tour of the site earlier this afternoon, and what you're seeing now is some of the video from that. To date, the clinic has given more than 45,000 first and second doses at this site. Today, the clinic is finishing up about 1,700 second doses of Pfizer and offering around 1,200 one-dose Johnson & Johnson vaccines. Health Commissioner Cooper is here with us in person this afternoon. Commissioner, thank you very, very much for joining with us. And if you could kind of tell us a little bit about how things are going.
Well, thank you, Governor DeWine. First of all, I'd like to, on behalf of Public Health Dayton, Montgomery County, and the Montgomery County Board of Health, and our community partners, we want to extend a warm welcome to you, Mrs. DeWine, and your team. It means a lot to us and our community that you are here today to kind of walk through, understand how we're serving our community and be supportive of our process. It struck me during that tour that we were on that you are probably the most photographed person in the state of Ohio. But there's a reason for that. People respect you, they trust you, and they know you will always make the decisions that are in the best interests of the greater good. I know we feel that way at Public Health Dayton and Montgomery County, so thank you again. First of all, yes, we've held over 40 clinics at this convention center since December 24th. And as you indicated, over 45,000 vaccines have been administered at this site. And then in total, our health department has administered over 52,000 vaccinations from the beginning of Ohio's vaccination program. So that would not be possible without our employees and their dedication, tremendous support from community partners across all jurisdictions in Montgomery County, as well as many, many volunteers that are devoting their time to serve. We are here 4 days per week, Tuesday through Thursday, as well as Saturday. And then as you saw today, we continue to refine our process to make sure that it's very professional and it's convenient to those who are coming here. And then we're very excited as we move forward to transition to the Johnson & Johnson vaccine. It is a safe vaccine, it's very effective, it's one dose, and it is in high demand by the citizens we serve. So we are very pleased to serve as a state-sponsored mass vaccination site.
Jeff, can you tell us a little bit? I know you all have been doing more vaccines really out into the community. It's one of the things that I really admire about what you all have done here. Can you tell us a little bit about that?
Yes, Governor. So your reference to being in the community. We know that many individuals have a variety of resources, and it's easy for them to come to a site like this to be vaccinated. But not every individual has those same resources. And so our focus as a health department is around promoting equity. And for us, that means making sure that all individuals have the opportunity to achieve optimal health. So when we look at Montgomery County's white population, for example, we know that they have a longer lifespan, experience less violence, experience less preventable chronic disease, more economic stability, and they have better access to health care. The data bear this out. Whereas if you're a minority individual, you tend to fare much worse in terms of health outcomes, and you have less opportunity to be healthy. And that's just not right. And so as a health department and as a board of health, we have said we're going to make sure that at least 25% of the vaccine that we receive is made available to our minority populations. So we've been working with our minority churches, we're looking at homebound populations, we're in congregate care locations, just making sure that we're promoting equity around vaccine distribution.
Well, we appreciate that. I think it's great job that you all have done. Maybe a final question. Someone lives in the Miami Valley and might be watching this or hearing about this. How do they sign up?
So it's changed now, and that's a really good question, Governor. Thank you for asking that. Traditionally, up until as of right now, individuals were able to go to our website, and it was a two-step process. So they scheduled their appointment through Eventbrite, and then we had a separate process for registration. And that was a little confusing to individuals. Whereas now, well, not only was it confusing, quite frankly, it was very resource intensive. It took a lot of staff and a lot of volunteers to manage that process. So we are transitioning effective tomorrow to the state vaccine management solutions system. And it will definitely streamline the process. Individuals will be able to determine eligibility, schedule an appointment, and then register all at gettheshot.coronavirus.ohio.gov. So we think of it essentially as a one-stop shop where individuals can find out where they can be vaccinated. And then to continue to promote health equity, our call center will still help individuals who either do not have internet access or have barriers to using an online system. So we're very excited about transitioning to the VMS system.
So, but people could still call the health department.
Call our call center at 937-225-6217 if they have any trouble doing this registration and appointment booking online.
Mr. Commissioner, thank you. Thank you for having us today. We're very proud of the great job that you all are doing, and your team out there just absolutely phenomenal.
Thank you, Governor.
Thank you
it means a
very
lot
much.
to us.
We have other mass vaccination sites. We're now going to go to Columbus. It's a drive-through clinic at the Celeste Center at the State Fairgrounds, and I see the Lieutenant Governor there, and I think I see Dr. Roberts, and I don't know whether the mayor is there or not. I don't see the mayor, but I'm glad you're there with Dr. Roberts, Health Commissioner of Columbus, and I'll turn it over to the Lieutenant Governor.
Thanks, Governor. It's great to see how well things are going in Montgomery County, and things are going really well here in Franklin County. I'm going to introduce Dr. Mashika Roberts, who has been leading Columbus Public Health and is a driving force behind this mass vaccination center, which has been operating for COVID purposes since December the 26th. And Dr. Roberts, come tell us a little bit about the facility and what's going on here, and we want to hear the report from you, because you've been at the heart of all this.
Well, thank you, Governor, and thank you, Lieutenant Governor. Glad that you are here with us today at the Celeste Center at the Fairgrounds, as the Governor mentioned. This is Columbus Public Health's mass vaccination clinic. It is drive-through. We have been here since the end of December doing COVID-19 vaccines, but we actually started here in October doing flu vaccines. To date, Columbus Public Health has given almost 90,000 vaccines. The majority of them have been here at the Celeste Center. We are operational here 6 days a week, Monday through Saturday, giving the vaccine. And 2 of those days, on Tuesday and Wednesdays, we actually have evening hours here at the Celeste Center. Obviously, on Monday, we became one of the state's regional vaccine sites, and we're happy for that. And that happened to be the same day we opened it up to all residents of Ohio who were 16 years of age and older. Here at our vaccine clinic, we offer Pfizer, Moderna, and Johnson & Johnson. Today is our first day doing Johnson & Johnson only, and we've got 2,500 individuals on our schedule today getting vaccinated. This is a joint effort between staff at Columbus Public Health as well as a partnership with our EMS providers through Columbus Fire Department, as well as Worthington Fire Department. And any day we open the doors here to vaccinate individuals, it takes about 75 staff collectively to make this happen. And we're just grateful that we have the opportunity to protect our community and provide them with a very safe and effective vaccine.
Doctor, thank you very, very much. I wonder if you could, I know, Dr. Roberts, you've done a great job also, as they have here in Montgomery County, reaching out to minority populations, getting out into the neighborhoods. I wonder if you could just give us a brief description of some of those things that you've been doing.
Sure, happy to, and thank you for that question. So yes, like Montgomery County and like Commissioner Cooper, we have been going out into the communities. So last week we had 2 Somali-focused clinics. These were vaccine clinics that were held at locations in the community where the Somali community feels comfortable going. We partnered with some of our community agencies to help us draw patients into that clinic. Then this week we had a clinic for the Latino community, again at a location that the Latino community felt comfortable going to. Every week at our health department, we have a clinic for those who live in our opportunity neighborhoods. These are neighborhoods within Columbus that have high infant mortality, low access to care, high unemployment rates, where we know the need is great. We cater to that community and have a special clinic just for them. And we can't go everywhere. So another thing we do is we partner with our federally qualified health centers. We get a little more vaccine than they do. So we give them some of our vaccines so they can go into our churches and provide vaccines to many of our church communities that are predominantly African American. So those are just a few of the things we've been doing to actively engage our minority population.
Doctor, thank you. Thank you for the great job you and your team are doing.
Yeah, Governor, I just wanted to add that they are doing 2,500 a day here now. They hope to get to 3,000. This is open 6 days a week. And if you want to sign up, you go to columbushealth.coronavirus.gov. It takes about 75 people out here to run this on a daily basis. Columbus Fire Department is providing vaccinations today. It's just what we see all around the state. Great team effort, people pulling together, solving the problem of the coronavirus by getting vaccinations in people's arms. They're moving here, moving around the state, and today's another step closer to the goal of herd immunity. So give it back to you, Governor.
Lieutenant Governor, thank you very much. Dr. Roberts, we appreciate it. Thank you very, very much. In addition to the sites here in Dayton and in Columbus, we have more than a dozen long-term regional mass vaccination clinics open or that will be opening very soon throughout the state of Ohio. Today, I'm announcing a new clinic that will be in Seneca County. We're seeing a high incidence of COVID-19 in that part of the state. We're now partnering with the Seneca County General Health District to offer a long-term drive-through clinic at 1600 North Union Street. The site is expected to open sometime next week. And so if you're living in that part of the state, watch for the news media and it will give you the date when that actually will start, we hope next week. We also expect that our drive-through site in Mansfield and Richland County, at the Richland County Fairgrounds, will also open next week. And then our mobile clinic in Jefferson County will start up soon as well. Jefferson County Clinic is planned to move from site to site, Steubenville, Toronto, Rayland, as well as Richfield. Again, watch the local media for those specific dates and those locations. We're still working out the schedule for these sites as they will vary based on the amount of vaccine that we get in Ohio each week. We have to make that adjustment every single week. But we'll have all the information also up on the Ohio Department of Health's website in the coming days. This website is coronavirus.ohio.gov/mass vaccination clinics. coronavirus.ohio.gov/mass vaccination clinics. The site has information on all of our regional mass vaccination clinics, including our mobile clinic that is being operated by Ohio Northern University. In fact, Fran and I will be up in Ada tomorrow to see how that is going. We look forward to being back at Ohio Northern. During the past few weeks, we've seen an increase, unfortunately, in cases. We saw, first of all, a plateau. Now what we're seeing is an increase, and we're also seeing an increase in positivity. I'd like Dr. Vanderhoff to tell us now exactly what he is seeing out there, what the epidemiologists are seeing, and what they're seeing specifically in regard to variants, and also what is going on in Michigan and other states. Doctor?
Thank you very much, Governor. Well, as you noted, we are in fact seeing increased COVID activity here in Ohio, and that mirrors much of what we're seeing in the rest of the nation. After a long and dramatic decline, cases leveled off last week and are rising this week. Nationally, this picture has been more dramatic in two hotspots, Michigan and the New York City, New Jersey area. In fact, according to the CDC, Michigan's upturn is more than 3.5 times what we're seeing in Ohio at this point, and appears to be driven substantially by variants, especially the B117 or so-called UK variant. Here in Ohio, variant activity continues to rise, especially B117 and the two California variants, B1427 and 1429. Together, these three account for more than 80% of our 620 genomic detections. And just to give you an idea of how quickly variants are spreading, our variant counts have jumped from 92 on March 12th to 173 March 19th, and of course, now today, 620. Cases, as I noted, are also up in Ohio for the first week in a long time. Our 7-day average of new cases per day was a little more than 1,800 this week, compared with 1,500 plus last week. And yesterday, we saw almost 2,500 new cases. Now, not surprisingly, this has been accompanied by a rise in our concurrent hospitalizations, up from 851 a week ago to 978 yesterday. And our 7-day rate of positive test results is also up to about 4% from about 3% in mid-March. And while all parts of the state appear to be impacted by rising cases and more variants, many of our highest case counts and almost half of our variant detections are in our northern Zone 1 counties. So while COVID-19 is certainly not limited to any particular part of the state, we are seeing more activity, including more variant activity, on our northern border with Michigan. So Ohio remains in a race against a virus that is now more contagious and is right back on our heels. But we can win this race as long as we don't falter, as long as we press on with consistent masking and vaccination, especially in light of this week's important and encouraging research out of the CDC, confirming that the vaccines remain powerful protection against COVID-19, even in the face of the variants. Governor?
Doctor, thank you very much for that report. And Zone 1, for everyone, really runs from Toledo all the way to the Mahoning Valley, runs clear across from Bryan all the way across our whole northern tier. That's what we consider to be Zone 1. Eric, let's look at some data now. So these are today's numbers. As you'll see, as Dr. Vanderhoff talked about, these are just in the last hour. Again, a significant increase in number of cases. Our hospitalizations are up above the average as well. ICU admissions are the same as the 21-day average. Eric, let's look at the next slide, please. Now, this is the good news. This is the number of vaccines that have been given. And as you can see, and I'm just now seeing these for the first time, a very good number for yesterday, over 89,000 And that's first shots. That's just the first shots. So that is a very, very good number. We're happy with that. We are now up to 29.74% of the total population of the state of Ohio has been vaccinated. And you'll see this number now almost approaching 3.5 million people with the first vaccine. Eric, let's look at the next slide. These are our counties, and then Eric, let's just go to the top 20. And again, top 20, and they certainly are not all in the northern tier, but you know, we can start off here: Clark County, Hancock, Monroe, Summit, Lucas, Huron, Belmont, Ottawa, Jefferson. So most of those are in the top part of the state. Eric, let's go to the next one. And this is our number. This is the number that we have been tracking for some time. We talked about when we were able to get below 50. We were going very well for a while, and now unfortunately it has really started to go up. We've reviewed the 2-week case rates at the county level, looking now at this number, which is statewide. For the past 2 Thursdays, our statewide averages were just under 150 cases per 100,000. The 2-week case rate has risen, unfortunately, to 167 cases per 100,000. New cases have been relatively flat throughout the month of March, but as we mentioned earlier and Dr. Vanderhoff talked about, we're starting to see these numbers creep back up. So we were headed in the right direction for a long time, but now they've started to go back up. Let's look at the alert system. This is our map that everyone's become familiar with. With the increase in cases per capita at the statewide level, we're also have seen case increases in 56 out of our 88 counties. At this point, there are not yet significant increases in healthcare utilization at the county level. So that's why most counties are still staying red or orange on our advisory map, not going up. We are seeing some fluctuations in our smaller counties where even small increases in transmission can move that case per capita number. Van Wert County, for example, moved from yellow to orange. We also have had 7 counties drop. 3 counties moved from red to orange. They're Auglaize, Paulding, and Scioto. 3 counties dropped from orange to yellow. Those are Carroll, Mercer, and Morgan. Clinton County dropped from red to yellow and had the largest decline of any county for cases per capita. Again, this is in the last 2 weeks. We should still remember that these case rates have been increasing in most part of the state. To get these numbers trending back down again, we're urging Ohioans 16 years of age or older to please get the vaccine. This is a race, as Dr. Vanderhoff said. We cannot vaccinate fast enough. These cases are going up. We're dealing with a variant that is more contagious. Very, very important. If you've not had the opportunity to get a vaccine, please take that opportunity. Let me talk for a moment about Ohio citizens who are not able to leave their home, literally cannot leave their home. Our local health departments have been doing a very good job going out and giving those homebound individuals vaccine. If you have a loved one who is homebound, cannot leave, please call your local health department if they have not had a vaccine yet. If you are one of those individuals who is homebound, pick up the phone, just call your local health department and tell them that. It is a process that is, it's a slow process simply because it is one person at a time. But our health departments are doing a very fine job in doing that. Please get on their list, and they will try to get this done. I know many of them are trying to use the Johnson & Johnson, which means just one trip out and just one inconvenience for the people who live in the home. I want to continue our discussion about where we are with our nursing homes in regard to continuing the vaccination. This is something that we're doing in Ohio. We're very proud of. that after we went through and gave the initial shots, and actually 3 initial visits, we are now going back to the nursing homes and making sure, and also the assisted living, and making sure that new people who have been hired, new residents who have come in, or somebody who has just changed their mind and decide, hey, I want a vaccine, we want to make sure they have the opportunity to do that. Last week, we shared the list of nursing homes and assisted living facilities who had not confirmed with the state their plans for continued vaccination of staff and residents. Every nursing home and assisted living facility needs to offer ongoing vaccination clinics, where that is through the Ohio COVID-19 Vaccination Maintenance Program, which is what we call it, or with their hospital, their health department, or other local partner. They have to have some partner. We're happy to partner with them and make sure it happens. As of March 25th, we still had not heard from more than 200 of these facilities throughout the state of Ohio. So last Thursday, as you may remember, we shared with you a list of the non-responsive facilities. We just had to hear from them. Today, we've had great results since then. We now only have 8 facilities that remain on the list, 2 nursing homes and 6 assisted living facilities. So the rest of them have reported in. Many of them have signed up with us. They will be able to get that vaccine. That is a great thing. Some of them also told us we've already signed up with someone else, and that's fine too. The only thing that we really want to make sure is that they do, in fact, everybody in these nursing homes continue to be able to get vaccinations. We have seen our cases per week go down, but we still have a ways to go. We've had great progress in our nursing homes, but we want to continue to work in that area. Let me talk for a moment. I talked about this a little bit last week about how we allocate doses. And if you recall, we started really focusing on the most vulnerable people. We started in our nursing homes, assisted living. We started with those over 80. We kept bringing that number down and opened it further and further up. As we did this, we stayed with a mathematical calculation based on the number of people in that county who were eligible to get the vaccine. And so every county per capita basically got the same. There's a 20% in there that had to do with high incidence of poverty, but basically every county has been getting the same. Now that we are totally wide open and that anybody can get this, what we anticipate in the not too distant future is that we will really start seeing a slackening in certain areas. Every area is not going to be the same. So as we continue to get additional vaccinations, we will make the decision every single week about where we deploy those. It will still be based primarily on population, but if we see a part of Ohio, an area of Ohio, city, zip code, whatever, that is really, people are backed up and there's really great demand, then we will surge more vaccine in there. And we started to do that with the orders that we're putting out today that will go into the federal government, the shipping orders for it to be shipped, the drugs to be shipped over the weekend, the vaccine to be shipped over the weekend. So I want to talk for a moment about that. We also will look at this every week from the perspective not just of population, not just of where the demand is greatest, but the third thing that we will look at is where we are seeing spikes and where it may be necessary to try to deploy more vaccine in places where we think they can get it into people's arms as quickly as possible. We have 2 new announcements in regard to the deployment of the vaccine. And again, we believe that in the not too distant future, we'll start seeing some slack, we'll start seeing some openings as certain areas the demand, it becomes less than the actual supply. And the good news is we saw the week that we're in now And next week, and we hope and we believe in the future, significant increase in the amount of vaccine. So we have made a decision beginning next week. We are going to try to vaccinate every college student in the state who wants the vaccine. And we have the ability to do this with the Johnson & Johnson. A lot of that will be deployed during this period of time. We know that most colleges are out around May 1. So there's a very limited period of time. Big picture is that, as I said, we have focused on the most vulnerable. And we continue to do that with the majority of our vaccine. We've opened this up. So everybody is now open. Everyone can get the vaccine. We know in the not too distant future, we will be looking at a situation where our goal will really switch. It will always be to offer vaccine to those who are vulnerable and really to everyone. But we have an obligation and an imperative, as you heard from what Dr. Vanderhoff said, to vaccinate people as quickly as we can and to increase the vaccination rate. And so that's why one of the reasons that we're going to create separate pods, and we're working with our universities. So let me go through again the reasons why beginning next week we will start vaccinating on college campuses. First of all, as I said, we believe that it will increase the percentage of those college students who actually get the vaccine. Doing it on campus with a large number of people on campus is very efficient, but we also believe that more of the college students will opt to get that vaccine if they can get it right there, and they can get it at the same time that their peers, their fellow students are there on campus to get it. So we believe that this will increase the percentage of that group of Ohio citizens who get the vaccine. While fewer of our young people get sick from COVID, the evidence clearly shows that they are significant carriers. And they're significant carriers because of their interaction with other people. That age group interacts more socialization, more movement, more contacts. And so it is a strategic move, frankly, to vaccinate them on campus before they get out in early May for the summer and scatter throughout the state and throughout the country. We also, as I said, have the ability to vaccinate a significant number of people in a very short period of time. So we've been working with our colleges for the last week to make these arrangements. We will start this next week. Not every college will be completed next week, certainly. Some of our major institutions, as far as size, it will take a matter of weeks to get that done, but we will start next week. And we're very excited about being able to do this. Second announcement, again, with the same purpose, and that is to increase uptake. We've been hearing from a lot of businesses, labor unions, other organizations who have said, if we could get vaccinated on the job site, we will get more of our employees vaccinated. And we are willing to make our business open for that. In some cases, some of the companies that want to do that are already providers. Some of the grocery store chains, for example, are already putting shots in people's arms. They now want to be able to do their own employees. There are other businesses that are not providers, are not providing vaccine, who want to partner with a health partner to be able to do that, to come in, whether it's a labor union, whether it's a business, might even be a church, but they want to be able to partner with the healthcare providers. So we will provide that can start a week from this coming Monday. So businesses, providers can start making the arrangements to do that. So beginning the week of April 12th, any vaccine provider in the state can take up to 25% of their vaccine allocation for that week and start doing closed pods of their own employees, or they can partner with local employers, labor unions, other organizations to provide the vaccine. We believe that the time is ripe now for that to happen. We've got a lot of requests for that to happen. We've held those back because we wanted to make sure there was enough vaccine out there for the general public. But we think that this is now the time, starting on April 12th, to be able to do that. And again, there's a limit of 25%. If any provider wants to go beyond that 25% in a week, they can ask us for a variance. We'll look at the total situation at that point and see whether or not there's enough vaccine in that area for the general public, and whether that number could be increased. But without that, they can go up to 25%. We're basically going to let the market take over at this part and allow those relationships that have already been started between healthcare providers and many times businesses to take place. Again, doing it on a shop floor, doing it in a factory, we think will increase the percentage of those employees who get it. It will be more convenient. The employer will be talking about it and messaging it. Again, it's all going to be voluntary, but we think that will increase the percentage, and that is so very, very important as we try to run this race, beat the variant, get many people vaccinated as quickly as we can. Lieutenant Governor, we'll turn it over to you for a couple comments, and then we'll open up for questions.
Well, Governor, that's great news. I know a lot of employers will be ready to get their employees vaccinated. I will tell you that I know, as a big fan of baseball and it being opening day in Cincinnati, I hope it's not snowing in Cincinnati like it is here in Columbus. So we have snow flurries as I look out the door. I'm going to start with a little economic news. We've been getting some questions as of late from businesses who ask whether or not they can return to using their offices for in-person work. I've taken that opportunity to explain to them that they've been allowed to do that for about 9 months now. So we want to clear up any confusion about that. There is no prohibition on returning to work for in-person, and that throughout the pandemic, people, once we lifted the stay-at-home order, have been able to do that. We just ask and advise that we take as many safety precautions as we can to create a safe workplace, and so that it's good for both the employees and any potential customers. But there is no prohibition on returning to work in person. And with your announcement that you just made, that with the opportunity for many employers to vaccinate their employees at work, I'm sure that there are many more of them that are going to want to do that. That'll make it easy and convenient, particularly for hourly workers who may not have had the chance to, if they're working 6 days a week, to get out and get that vaccination. So that is welcome news. I will also wanted to announce a website called topjobs.ohio.gov. And we're going to officially announce today that we're going to be doing a virtual in-demand jobs week on in May the 3rd through the 7th, first full week of May. And we're going to highlight the top jobs that are available in Ohio. And it's great that I'm here at the Celeste Center with all of these healthcare workers back behind me, because healthcare jobs, there are a lot of them. We need to help people get trained to take them. And healthcare workers like nurses, pharmacists, STEM workers, medical assistants, chemists, a lot of those are on this list of top jobs. And we want the business and education and community organizations to be ready for this, because we want to do a great job with this. Because let's face it, we're going to have a lot of virtual tours and roundtables and things like that, where we're going to highlight these jobs. But that's also that we're getting to a time that students are going to make the next decision about what they're going to do in the upcoming school year. And we want them to know about the jobs that are available, what many of those jobs pay, and how they can get trained to get those jobs. So in preparation for that, you can visit topjobs.ohio.gov, topjobs.ohio.gov, for in-demand jobs week information, mapping, and so forth. And right now, as I always like to remind, there are a lot of jobs available out there in Ohio. 167,000 of them, more than that on ohiomeansjobs.com. 88,380 of those jobs pay over $50,000 a year. I know I got a call just this morning from an employer who had 18 jobs that he couldn't fill. Employers, the economy is coming back in our state very aggressively. There are jobs out there. We just need to make that match work, getting people connected with the jobs that they're most trained for and fit their interests and aptitudes. And then finally, another round of Tech Cred is opening up at techcred.ohio.gov. We're going to run this through the month of April. If you are an employer and you have a great employee, you have employees that do a great job, but maybe they need to be upskilled. They need some new skills because technology is changing the nature of work. You can use Tech Cred to help upskill them. We pay up to $2,000 to help one of your employees earn an industry recognized credential. There's also an individualized program. If you're out of work and you want to upgrade that, you can also find that through the Tech Cred website. Over 1,100 businesses have participated so far, and we've given the opportunity to earn 19,841 tech credentials so far, just since we started the program, Governor. And as you know, I'll make another pitch to the legislature on this. Our goal the first year was to upskill 10,000 people. The demand has been so high, we're asking the legislature to give us more resources in our economic recovery package so that we can help 25,000 people a year upskill and earn these industry recognized credentials. And if we can get that done, Ohio's economic recovery will be enhanced, people's ability to earn more, have more job security, and lead their version of the American dream will be enhanced. And so we encourage you to go check out the jobs, the training, and everything that's available at these websites, topjobs.ohio, the topjobs.ohio.gov website, and the Tech Cred website as well. So back to you, Governor.
Governor, thank you very much. We're ready for questions.
Governor, first question will be on site in Dayton from Allison Walker of WKEF.
We gotta get you on mic there. You're good. No, you're good. Go ahead. Go ahead. That's good.
So nice to see you again, Governor.
See you.
Can you give us an update on Senate Bill 22? Will you take legal action before it goes into effect in 90 days? And is there a potential that you could escalate this to a federal appeals court?
Well, we haven't made any decision about that, and I'm not aware of any other group that has made any decision. I think I've explained my position on the bill and my concern about the future, the long-term future, what will happen in the future, even beyond when I'm governor, some of the provisions of the bill. So we will see. We're still asking our lawyers to take a look at that.
Next question online is from Adrian Robbins at WCMH in Columbus.
Hi, Governor, thank you for taking our questions. When it comes to our rising case numbers, how concerned are you that this could impact what you recommend people do when it comes to graduation parties or proms, all these kind of fun things we've been talking about doing this spring? If our numbers reach the case of what we're seeing in our neighboring state of Michigan, how much could that change what you're recommending?
Well, our recommendation has always been based upon what we're seeing currently. And that's really the best that we can do. We don't have a crystal ball look in the future. I think in the long run, frankly, things are going to get better. And as we vaccinate more and more people, it will be harder and harder for this virus to travel from person to person. But, in the next month, next 2 months, we are concerned, and we're concerned for the reasons that Dr. Vanderhoff was talking about. We're concerned about what is going on in Michigan. Michigan is one of the hottest spots, unfortunately, in the country. We're concerned by the fact that we're seeing our cases up in the northern part of the state of Ohio, particularly. We're seeing our positivity rate that had been going down for several months now start to back up. It was at 3.2, 3.0. Now it's above 4. So these are just all very, very troubling signs. So we don't really know where this is going to be, by the first part of May, where it's going to be by the first part of June. But we know what we have to do. And what we have to do is stay on defense by wearing masks, and Ohioans have done a phenomenal job in that regard. Still at 93, 94% of people in retail when you walk into a retail store, 93, 94% of the people on average are wearing a mask. That's still very, very good. It's better than many other states. And we're very proud of Ohioans for being able to do that. The other thing is the vaccinations. And the things that I announced today are efforts to speed up vaccination, make sure that all the doses that we have are taken up just as quickly as they can be. In regard to specifics about proms, in regard to graduations, the basics are still best. And I would just advise people to stay with the basics. Don't make it too complicated. Wearing a mask does a tremendous amount of good. And so if people will wear masks during those events, that's great. If it's possible to have the event outside rather than inside, we know that makes a huge, huge difference as well. Washing hands, keeping some distance. I still believe that most of the things that people want to do, they can do as long as they follow the precautions. There's going to be fans, Great American Ballpark today. Fans going to be there. I think they're going to be safe. They're going to be outside. They're going to be wearing masks. People are going to be in compliance. They're going to be in pods. I think after a year, people want to live and they want to go do things, but keeping masks on and keeping distance, those are just essential things. I think if we follow those things, we can do things that we want to do. But we've got to stay at it. We can't quit.
Next question is on site at Dayton from Jim Oddie at WHIO.
Hey, Jim.
Hey, Governor. Welcome back to downtown Dayton.
Thank you.
Hey, when you go to college campuses next week, let's talk about how this is going to work. Do you anticipate having any difficulty convincing this age group to get the vaccine? Remember, for the last year, we've been all telling them this is something that really targets the virus, that is, really targets nursing homes primarily. And now all of a sudden we're saying, no, it's now your turn to get it. How do you sell this to college students?
Well, Jim, a very interesting thing that Fran and I saw today here at the convention center as we walked around, we saw a lot of young people. We saw college students. We saw people in their 20s. So I think you're starting to see people younger age, use the opportunity to get vaccinated. I think that they understand that they can be spreaders. I think they want to go see their grandmother. They want to go see family and friends. And it just is something that I think you're going to see a lot of young people do. No one is going to force anybody to get the vaccine, but I think doing it on the college campus, very convenient for the students. They see other college students doing it. I think that that will increase the percentage of college students who are willing to get it. We've talked to the university presidents. They very much want to do this, and we're going to provide that beginning next week. The vaccine will start flowing into Ohio on Sunday. The other thing I would say that from the majority of these colleges where this will be done, it will be a one-shot deal. And I think that has a very significant appeal to a number of young people. They can get it, that's it, they're done. So we're very, very excited about it. And I think it's going to increase the number of young people who get it.
Next question online is from Laura Hancock at cleveland.com.
Hi, Governor. The cases per 100,000, which is the measure that you have set for lifting health orders, has gone up instead of gone down for the last 2 straight weeks, meaning we're actually going backwards instead of moving forward toward your goal. Do you plan to stick with that metric as the basis of your decision, or do you think you will change that?
I'm sorry, do I find it what? I didn't catch the word. I'm sorry.
Will you stick with the metric of 50 cases per 100,000, or do you think you're going to change that?
No, science would not indicate any reason to change that. But I think we'll change it is the number of people who get vaccinated. I mean, literally every day, you can look at the numbers that we put up there. I know you do every single day. We're getting more and more of our Ohioans who are getting vaccinated. And, we're clipping off at 80,000, 85,000 many days. And we think that will, those numbers are going to continue. So every single day we make it harder for the vaccine, every single day we make it harder for the virus to jump from one person to another. But it is a race, and this variant is pushing things up. It's much more contagious. So we're in a battle, and we have to understand that we are in a battle. But we've got a pretty big cannon, and that cannon is the vaccine, and we just need to keep deploying it every single day. And we'll wear this virus down, and we will win.
Next question online is from Jordan Vanderberg at WEWS in Cleveland.
Happy opening day, Governor. Thank you for your time.
Happy opening day.
The question I've got for you is related to the mass vaccination site at the Wilson Center. It's received rave reviews just with how efficient it has been and how many people are getting vaccinated. However, the data shows that the vaccination rates in minority communities continue to lag behind. What is being done on the state, local level to improve these numbers? And is there anything more that can be done?
Well, Jordan, there's always more we can do. And, we can never be satisfied, and we never should be satisfied. But what you heard from the 2 health commissioners at the beginning of this show, they're not satisfied. They're not staying in a place like this, even though this is right downtown, very close to significant minority population, but they're going into churches. They're going into communities. We've set our National Guard into, I think, over 100 high-rise apartments that are very significantly African-American and other minorities. So that effort will continue. If you just look at the mass vaccination site at the Wolstein Center, part of those are reserved every single day for community partners. We have, I think, 60, 70 community partners in Cleveland, and they are signing up people who are in underserved areas, slotting them in. We're also, have plans to take the vaccine. It's already going out in many communities into the neighborhoods. So The effort is certainly being made, but we'll continue to do that, and we'll continue to push on that. And we're certainly not satisfied where we are, but I think we've made it, considerable progress.
Next question online is from Danny Eldridge at Hannah News Service.
Hello, Governor.
Danny?
Can you talk a little bit about which universities are going to be focused on, and are any of the universities saying, if you want to come back to campus next year, you're going to have to be vaccinated anyway as a way to sell it to college students?
Well, I'm not aware of any colleges or universities that have said that, but we have reached out not just to our state universities, we have reached out to our private schools. We are blessed in Ohio, as you know, with a number of great liberal arts schools, as well as major universities. And I think virtually every single one is taking us up on our offer to supply that vaccine. And so we are very excited about this. And it's something that pretty much every school that you can think of will be involved in this program. I think there's one or two small ones who are nursing schools where everyone is already been vaccinated. But I think virtually every single college in the state will be covered by this program.
Next question online is from Dustin Ensinger at Gongwer News Service.
Hi, Governor. I was wondering if you have any thoughts on the infrastructure plan that the Biden administration unveiled yesterday.
Well, we certainly have infrastructure needs, and one of the things that we're looking at in our administration and talking with the General Assembly is some of the dollars that are coming directly to the state in the previous bill, the bill that's already passed. How those dollars can be deployed in regard to infrastructure. Infrastructure certainly includes the internet. It includes all the traditional things that we think about in regard to infrastructure, clean water. Fran and I were in Vinton County, and they told us about a community of people when they get their water out of their well. It looks like it's Coca-Cola. Literally, they showed us a picture of that. We have too many people in Ohio who do not have access to good water. So that's an infrastructure issue. I think, frankly, lead paint is having lead paint and poisoning young kids, that's an infrastructure issue as well. So there's great opportunity, I think, for the money that's already been sent to the state by the last bill. I'm not going over this entire bill that the president has proposed, or the proposal. So that's going to play out. People will have the ability to talk about that in the weeks ahead.
Next question online is from Sarah Arthurs at the Findlay Courier.
Hello, Governor. Thank you.
Sure.
I'm wondering, one thing I hear from people in rural communities in Northwest Ohio is that some of the obstacles to getting people vaccinated look a little different than they do in the cities. Some people don't have transportation. Some people, as I know you're aware, don't have reliable internet access, which makes it hard to sign up. I'm wondering, as you travel to vaccination sites, what differences you've seen rural versus urban, and how is the state helping rural communities? Thank you.
Sarah, I think that's a very good question. I think that different people in different parts of the state have different challenges. There are challenges, there can be challenges everywhere. It can be a transportation challenge in the city. It can be a transportation challenge in a rural area. It can be access to internet, but that can be a problem in the city. It can also be a problem in the rural parts of the state. We constantly are working with our local partners, the providers, 1,300 providers that we have out there, plus the mass vaccination sites, plus the health departments who are really, really focused on this, about how we overcome problems. And, we now have a statewide number that people can call. If they can't, if they've got a phone, they can call that number. We have people on there, operators, who will in turn go on the internet and go into our system and find a location where that person can get the shot. They do not have to be able to navigate the internet themselves. You can pick up the phone and do that. Our local health departments are doing it. Our local health departments are going out, as I mentioned earlier, doing one-on-one, literally someone who's in their home and they cannot leave their home. That can be a problem in the city. It can be a problem in the rural areas as well. So they're doing a good job on that, but it's not perfect. And we continue to try to improve it every single day. But certainly it can be a challenge. It can be a challenge in the urban area. It can be a challenge in the rural area and the suburbs as well.
Next question online is from Justin Dennis at mahoningmatters.com.
Good afternoon, Governor. Thanks as always for briefing us today.
Justin.
Two of our local representatives are sponsoring legislation to head off this concept of vaccine passports in Ohio. Just wondering what your thoughts are on this concept that we've seen in New York and how you think such a thing could be used in the state.
Well, we don't have any plans, to create the passport. I think we'll have to see, what the desires are out there. Businesses can make their own decisions and people can make their own decisions about these things. But, and I've not really looked at the legislation, so I'm not aware of exactly what that legislation would do. What would it do? I don't know if Justin, if you're still on there.
Sorry. We haven't seen the full text yet. So,
Okay.
but the essential.
But what? I'm sorry.
It would essentially stop them from being implemented in the state. Is my
Yeah, I mean, we don't have any plan. We have no plan to require a vaccine passport to do things. We don't have that plan in the government of the state of Ohio. As governor, I don't have that plan.
Next question online is from Marty Schlayton at the Ohio Capitol Journal.
Good afternoon. I've got a question for, how are you, Governor?
Good, sir.
Good. A question for Lieutenant Governor Husted. He told the Associated Press that he holds the Chinese government responsible for the coronavirus crisis. And I wanted to know whether by that he means he agrees with Dr. Redfield that the coronavirus came out of a Wuhan lab, or whether he's criticizing the Chinese government's handling of the virus. And if so, does he also have any criticisms for the Trump administration's handling, given the criticisms that have recently come from Trump's own pandemic team?
Let me see if the Lieutenant Governor is still on.
Yeah, Governor, I'm here. Look, it's not just me that are asking these questions. It's the Biden administration, it's the European Union, it's the United Kingdom and Australia, who believe that there should be an independent investigation into what happened in Wuhan. That is where the first case was reported. That is where the lab exists, where they do experimentation on enhancing the active capacity of viruses. It is believed by many that this pandemic originated there well in advance of when the Chinese government disclosed it. This pandemic and the culpability that I believe the Chinese government has in it is important. It has killed 2.7 million people worldwide, over 18,000 people in Ohio. And I'm glad that governments around the world are challenging the WHO and the Chinese government to come clean on this, to allow for an independent investigation. And I will continue to speak out on that because I believe it's important. So yes.
Next question online is from Nathan Hart at WCPO in Cincinnati.
Hi, Governor. I was wondering if you had any advice or guidelines for families that might want to get together where they have vaccinated adults, but their children aren't vaccinated.
Yeah, I'm going to go to Dr. Vanderhoff, see if doctor's still on here.
Yes, Governor, I am, and thank you for that question. So the advice that I would have would really be very similar to what we've advised in other holiday settings. When you're getting together with people who have not yet been vaccinated, and they're not a part of your household, they're not a part of what we used to call your bubble. The best thing you can do is to follow the basics. Masking, maintaining distance as much as you can. the fact is that when people who are vaccinated get together, they've created a bubble of immunity among themselves. But when vaccinated people get together with unvaccinated people, that's not true. And so that's where we have to follow the very reasonable steps that we know work, even when we're gathering this holiday.
And let me just add, as grandparents and parents, I think that is it's a difficult challenge because we have kids who are in school. Fran and I have grandkids who are in school, as many of you do, and you know they can't be vaccinated yet. So we're really looking forward to the day when, however long that is, we hope it's not too far away, that children will be able to be vaccinated, and we're all looking forward to that.
Next question is on site at Dayton from Chris Smith at WDTN.
They got you up there.
Yeah, I wasn't prepared for this, Governor.
Got you at the podium. You look good at the podium, though.
Thank you. I'm very underdressed, and I apologize for that. First and foremost, I want to wish you and your family, the DeWine family, a happy Good Friday and a happy Easter weekend. Words of encouragement, Governor, for individuals who may not be documented citizens yet in the state of Ohio, who are on the fence about getting the COVID vaccine, and any words of encouragement for you to have them step forward to get the vaccine if they can.
Yeah, we would love to get you vaccinated. It's important for you. It's important for your family. It's important for the rest of us. The more people that we can get vaccinated in the state of Ohio, the better off it's going to be for everyone. And, this is about health. This is about being vaccinated. This is about taking care of your families. And this is the best way to do it. And we really would encourage you to do it. There's many opportunities around the state of Ohio to do that, and we would encourage you to do it.
Next question comes on site at the Celeste Center from Jeff Reddick at WSYX in Columbus.
Actually, it's going to come from Maria Durant with WSYX. Justice, let me ask this question, and this is the question to the Lieutenant Governor. Lieutenant Governor, I spoke with several Asian American parents this morning, those parents from Upper Arlington, from your community. I know that yesterday they sent you a letter concerned about the words that you said when you described the virus as the Wuhan virus. They said that those words are very hurtful. And in a climate where we are seeing an increase in Asian American violence, why would you choose to use those words? And will you meet with those parents who are in your community in Upper Arlington?
Well, I appreciate the question, and I will say this. It's important to understand the context in which you do things. And the context for my words were built around an article that I posted where the ex-CDC director believed that the coronavirus originated in a Wuhan lab. That was the title of the article. And I reposted the article and asked the question, so it appears it was the Wuhan virus after all, ? Asking the same questions that many people are, including 60 Minutes on Sunday night, including the governments of the United States, United Kingdom, all around the globe. Wuhan is inseparable from this story because Wuhan is where the first case was documented. It's where the lab exists that's doing research to make viruses more aggressive. It's not an ethnicity. Wuhan is not an ethnicity. It is a city. My words were directed at what I believe is a probable cover-up by the Chinese government for a virus that has killed 2.7 million people around the globe. It has disrupted the lives of nearly every person on the planet. That's why we're here today. What happened there is why we're here today and why people are doing this all over the world right now. And I believe that there needs to be an independent investigation into it. I don't believe the narrative that's out there about it right now, and I'm trying to draw attention to that. Now, having said that, I acknowledge I acknowledge people who disagree with me on this. I've used this as an opportunity not just to draw attention to what my concern is, but to draw attention to what their concerns are. Because there's no justification ever for hate or acts of violence against anybody, any ethnicity, any religion, for any reason. Asian Americans, by the way, I have many Asian American friends in my own community, including those of my children, who I've talked with about this. And Asian Americans in this country have been contributors to the greatness of this nation. In the past, in our military, in every walk of life. And they've contributed to making this a wonderful country. And I'm specifically empathetic to the issues surrounding Chinese Americans because of what the Chinese government has done that has affected Ohioans and Americans. And let me just go through this because I wrote a couple notes down. It's just about affecting Ohio. The Chinese government has been responsible in part by not stemming the flow of fentanyl. China has been involved in stealing intellectual property from the Cleveland Clinic, Nationwide Children's, Ohio State University, and Ohio businesses that do business in China. And some of the theft from our pandemic unemployment system and cybersecurity threats are connected to China. There have been 4 communicable diseases that have come from China in the past 20 years, including the latest one, the virus, the coronavirus that we're dealing with now. But this in no way is the fault of Chinese Americans. It is the responsibility of the Chinese government. And so I will use this opportunity to say all that. I did not get a chance to see the letter. It did not come to me, did not come to our office. We've been able to track it down. I will look at that letter. I will respond to that letter. I value people who disagree with me. I like to try to build bridges with people who do. But at the same time, I don't want to confuse the situation about what my words were about. My words were about the Chinese government, the responsibility that they have. They were not directed towards anyone, any ethnicity, and hopefully these conversations get a chance to clear all those things up. I'll look at the letter. I'll respond appropriately. You can count on that.
Next question online is from Joe Ingles at Ohio Public Radio and Television.
Hi, Joe.
Hi there. Sorry about that. I couldn't get it to unmute. Governor, you're saying you don't want the vaccine passports, but we're seeing polling that's coming out that's showing more than 25% of the people polled say they're not going to get this vaccine, or at least not going to get it anytime soon. We're seeing Ohio legislators who are also saying they're not going to get it anytime soon. And you're saying businesses can, have these vaccine clinics and they can, tell people that they have to get the vaccine, their employees, they can mandate that for their employees. But the question is, there are so many people. I mean, if you're talking 25% of the population, that's a good chunk. So are you ever going to be able to get to herd immunity or get out of this if you really don't have anything that's enforcing it and making people get it?
Well, Joe, I don't know any state that is requiring people to get this vaccine. That's not what we do. I think that the facts will win out. That does not mean everyone will get the vaccine, just like everyone does not get every other vaccine. We don't have 100% compliance on any vaccine. But my experience has been, as I've traveled around the state, and Fran, I've talked to people, is that they're influenced by their own doctor. They're influenced by their spouse. They're influenced by their family, and they're influenced by their close friends. And they are the persuadables. It's like anything else in life. There are people who are on one side, people on the other, and then there are people who can be persuaded. There certainly are some people in Ohio who, are not going to become vaccinated. They're adamant about that. But there are other people who want more information, maybe have wanted to wait a while till they see what the reaction is. And I think as more millions and millions of people across this country are vaccinated every single day, the experience level goes up. And I recall one man that Fran and I talked to, and he said, I'm the first one in my family to get it. I'm going home and tell everybody else they really need to get it. And I'm betting on him because I think he will be able to persuade them. I won't be able to. Other people won't be able to. But his family, he'll be able to persuade his family. We've had other people, another person that we talked to said, I'm the last one in my family. I was the holdout. But they kept after me. I came in today because they asked me to come, and I'm glad I did. So I think it's what we do in most things in life. We rely on people we trust. We rely on people we love. And I believe that, we're doing okay so far. I think we're doing very well. We just have to keep going. And you look at these numbers, Joe, people over 65 years of age, over 70, those numbers, over 70 are better than 70% now. They creep up every single day. Not only did we see young people out there today, we saw one man who was, I think, 86, they told us. So these numbers they're going to keep going up. And we just have to make it as easy as we can for people. We have to tell people the truth. We have to be candid with them. And this thing will work. We will get there.
Next question is on site at Dayton. It's from Caitlin Schroeder at the Dayton Daily News.
Hi, Governor. My question is that with the variant cases being particularly detected near the Michigan border, are the two states doing any coordinating or conversations about responding to this surge?
Well, I know that the medical people are talking back and forth. I've not talked to the governor for a while, but frankly, I've been last couple of days thinking I was going to pick up the phone and call her. So I'll be doing that in the next couple of days.
Thank you.
Next question online is from David Winter at WKRC in Cincinnati.
Thank you for the time, Governor. Back to requiring the vaccine. Right now, it's under emergency use authorization. So I think that's probably why you're not seeing other states doing things like requiring vaccines. But as soon as it is given actual authorization by the FDA for regular vaccination use, why not require it in schools like diphtheria, polio, tetanus, all the others? Doesn't it just make sense that we don't want to have this as an ongoing problem?
Well, again, this has not been done. I've not talked to any governor who indicated that he or she was going to try to do that. I will share with you a story. I was talking to a friend of mine, and I won't say what county it was, it's in the rural part of the state, who said, and I wasn't suggesting it, but we had a conversation, who said, you require something, you'll have less people do it. You let us figure this out ourselves, you let us make our own decision, and you'll have more compliance. So, we're not going, I want to make it very clear, we're not going to mandate this. This is not our intention. We think we can get where we need to go the way we're going. We think there is a pathway there. We're on the track. We're on the pathway. We're moving. We just have to keep moving forward.
Next question online is from Andrew Welsh-Huggins at the Associated Press.
Hi, Governor. Can you hear me okay?
Yes, sir.
Thanks as always for doing this. So real quick, back to the passport question. I don't think what's at play here necessarily is the state requiring people to get the vaccine, and you've made that point well. I think what's being floated is the idea of a sort of a digital passport that, say, the airline industry or sports arenas could use to require people. In other words, you're not going to be able to fly if you can't show us this digital passport that shows you received a vaccine, or you're not going to be allowed to enter this sports arena or perhaps a particular industry. So I guess my question is, if such a digital passport is created and begins to receive widespread use by those industries, and if there was legislation in Ohio to ban that, I guess what would your position be on that, where the airlines are saying you can't fly without such a passport, but suddenly Ohio legislators are saying, sorry, we're going to ban that in this state? Thank you.
Well, Andrew, it's a good question, but it's based on two hypotheticals. And I don't usually like to do one hypothetical. So I'm not going to answer that. What I do believe is that, if this is going to happen, as you pointed out, the hypothetical examples that could happen, the market will develop. Is it possible that somebody will come up with that and say only people who have been vaccinated can do thus and so, or a cruise ship that only has vaccinated people? I don't know. I don't know where the market is on that. But the market will determine that. And, there are other ways of, people showing that they have in fact been vaccinated. But I just think at this point, it's too hypothetical, for me to kind of even speculate on it.
Governor, next question is the last question for today, and it comes online from John London at WLWT in Cincinnati.
Governor, with more people being vaccinated, there's a real back to normal desire. There's a growing sense of I'm good, I'm fully vaxxed now, so I'm going to go back to normal, no longer distancing all that much. We have seen that at the Dora district down here along the river at the banks last Saturday night, and again today, opening day, which is packed, people shoulder to shoulder, not much distance, not much masking at all. Now it is outside, but what can you say about that situation with regard to the risk of contributing to community spread?
Yeah, I saw the picture of the Dora a few days ago, and look, it's troubling. John, as you said, they're outside, and that's the best thing I can say. They are outside, but more people wearing masks would certainly make me feel a lot better. It would not be in that close proximity. It would not be a place where I would advise my family to go. It would not be a place that I would go. I think it's with the variant that we're seeing in Ohio, it is more contagious. And we can assume the variant is in a lot of different places in Ohio. It's more contagious than it was 6 months ago or 3 months ago. So I think that's a mistake. I think it's a mistake for people to be that close to each other. Now, it's a very different thing inside the ballpark. Inside the ballpark, there's rules. People are wearing masks. People are in pods. They're outside. That, as far as I'm concerned, is a very safe environment. So doesn't mean that people have to stop doing anything they're doing. I just think when you see something like that Dora, it just doesn't make any sense. Good sense to be doing that. So one last question for you, John. Is it snowing in Cincinnati or raining? Or how are we doing down there?
It was snow flurries. We wish you were here down at the ballpark to enjoy the game. I know you like baseball, but it's more football weather today than
it's kind of cold, but it is opening day, and it is Cincinnati opening day, which is always a great thing. Thank you very much. So let me conclude, next week is National Public Health Week. I want to take a moment to thank all of our public health workers, everyone who does such a great job. This past year has been just unprecedented. We want to thank you for all the work that you have been doing. I also want to mention that today marks the beginning of Minority Health Month. We'll be highlighting activities and health issues affecting our racial and ethnic minorities. The theme for Minority Health Month is Vaccine Ready. We want to encourage all of our racial and ethnic minority populations to get vaccinated and everyone to get vaccinated. And we've been working hard to break down any barriers for these communities to get the vaccine, including providing transportation, services, and mobile clinics. To encourage vaccination, Premier Health, in partnership with Gem City Medical Dental Pharmaceutical Society, an association of Black healthcare professionals from across the Miami Valley region, they all working together produced a public service announcement to instill confidence in communities of color about the effectiveness of COVID-19 vaccine. This PSA will appear on local TV here in Dayton, will be shared throughout digital campaigns, and so let's take a look.
COVID-19 causes more harm to communities of color.
More hospitalizations, more deaths, more exposures.
This virus is a threat to us.
The COVID-19 vaccines work.
Scientists of color and clinical trial participants of color
Have been key to making it a reality.
We can trust these vaccines.
That's why I chose to get vaccinated.
Hope everybody has a good day. Thank you very much.